So in lobular, it's actually one of the very interesting histologies of breast cancer, because we are having emerging data that shows that a subset of lobular breast cancer will have a very high chance at responding to immunotherapy. We did have a little bit of studies that have already been published that, for example, one study looked at an immunotherapy called pembrolizumab, and it found that 2/3 of responders in hormone receptor positive breast cancer had lobular histology. So that was really interesting. And we have another study from Europe that showed some patients who received immunotherapy with lobular histology had prolonged durable responses. So the idea is we worked at MD Anderson to unmask those groups, and we did find some characteristic that can really predict who can respond to immunotherapy and who will not respond to immunotherapy. And this is something we are trying to open a study. It's a chemo-free study for patients with lobular histology that become endocrine refractory and are ready to get chemotherapies. Those patients, we're going to offer them a non-chemo regimen that contains immunotherapy. Other mechanisms of resistance in lobular breast cancer are currently being underway, but one of the major mechanisms that was unveiled is the axis called the PI3 kinase AKT mTOR pathway, which seems to be very active in lobular cancer, irrespective of a mutation in that pathway. So about 70% of patients will have a mutation in that pathway, but also the 30% who don't have mutation have hyperactivation of that pathway. So this is an area of big interest to target.